The University of Arkansas for Medical Sciences is one of only a handful of institutions in the US that has a dedicated Center for Health Literacy. And what makes their model particularly interesting is that it's focused less on publishing papers and more on putting health literacy into practice. So today, we'll hear from Katie Leath, who leads this center and whose small but mighty team works across the health system to improve how health information is written, translated, taught, and delivered. Welcome back to Health Literacy in Real Life, or IRL. On this podcast, we look beyond personal health literacy and instead look at how systems, organizations, and care models can make it easier for people to understand and use health information in their everyday lives. I'm Megan Freeland, a public health pharmacist whose work is a blend of health literacy, patient advocacy, and patient education. Today, I am joined by Katie Leath, Director of the Center for Health Literacy at the University of Arkansas for Medical Sciences. For more than a decade, Katie has worked to bring health literacy in plain language into healthcare, research, and public health practice. She leads a talented team who works to make health information more accessible, more understandable, and more actionable by developing award-winning materials, training health professionals and students, and consulting on best practices in health literacy. Katie also serves on the board of the Center for Plain Language and as regional coordinator for the newly formed U.S. Health Literacy Association, supporting national efforts to make information easier to understand and use. Katie, thank you so much for joining us to shed light on what organizational health literacy looks like at scale from your unique vantage point.
Yeah, thanks for having me. This will be fun.
I think so too. I am always interested to meet fellow health literacy professionals and learn more about what brought you to this particular pathway. For me, it's a pharmacy background. For others, it's a nursing background, some public health, and some, which are particularly interesting, come from completely outside of the healthcare or public health ecosystem. So, why don't we begin by you bringing us into how you got started along this health literacy journey?
Yeah, so it's kind of a long story. First, it was my mentor, Dr. Christy Haddon, who was our founding executive director. At that time, she had a plain language preceptorship program during my master's in public health studies. And so during that time, two things really clicked for me. First, I was working in health policy research, and I realized the people that in that context that we needed to communicate with most effectively, like lawmakers, were essentially a lay audience. They're responsible for decisions across dozens of complex issues, so they really have to be generalists, and the complexities of health can be just as unfamiliar, I think, really to them as they are to anybody else. And that really drove home to me how critical clear communication is for helping people understand issues and really act on them. And then the second was more of a personal experience around the time that I was in that plain language program. I had my son prematurely at 31 weeks, and he spent 50 days in the NICU at Arkansas Children's. And early on in our stay, my husband and I were really trying to figure out, gosh, what is this going to cost? Like, we see all these machines and we know how many days they're telling you how many days he's probably going to have to stay. This has got to be expensive, right? And even before that, I spent 5 days in the hospital myself and had multiple emergency visits and visits with my OBGYN. So what is all this going to cost? So even with insurance and education and years working in a kind of a health adjacent field, I still couldn't make sense of my insurance math. Like, it wasn't math for me. And it took a friend, a coworker, bringing over all of our insurance information over to the NICU and helping me figure out, deductibles and max out of pocket and co-insurance and all that to really understand what the check was going to be that we were going to have to write. And these experiences really reinforced to me that anyone could struggle with health information. And if it's complex, then that's even worse. And if someone like me struggles to understand, we really have pretty serious communication problems.
I walked away with that same takeaway listening to you talk about both the professional and the personal angle of it, because it really does drive home the point that health literacy is not about how smart you are or how educated you are. The statistic is nearly 9 out of 10 adults in the US will struggle with limited health literacy at some point. That is the vast majority of the population. That's if you account for all of the health professionals and all of the people above a certain education level or in a socioeconomic class, that's still a significant portion of the population that at some point in time experiences that limited health literacy. And these are two great examples of how, depending on the context, the topic, and a lot of other variables, people need support and people need help. So thank you for sharing that perspective. So how did you come to lead the Center for Health Literacy at UAMS? How did that transition happen for you?
So I kind of joke that I became the director because I outlasted everybody else because
Share, will, or might. I love it.
it's been kind of a gradual process. So after that preceptorship experience and then graduating with my MPH, CHL ended up having a job opening and I was invited to apply and ended up getting the job. So my first role here was as the program administrator for health literacy services and communication. And I led and developed our services for clients at UAMS and beyond. And then when Dr. Haddon left, another director took over, and I was promoted then and continued to grow in my skills and understanding of health literacy. And then that director retired, and so then I was promoted again. So that's like over the last 10 years how I've grown in that role.
Yeah, so you're the perfect person to speak with because you have experienced the evolution of the center over a considerable period of time and also at many different levels. So maybe you could share with us how you all define health literacy at UAMS.
Sometimes it's misunderstood. It's often thought of as just a patient skill, but we really see it more as a system design challenge. Ideally, obviously, people should be able to find and understand and use health information to take care of their health, but organizations have a huge responsibility in making that possible and how we communicate with people, how we design our systems. So it's not just about the patient's ability, it's about how clearly organizations communicate and how easily they make their systems to navigate. And that's like to me on a individual organization level, but then also like a bigger
Mhm.
total systems level too.
Yeah. So no easy feat for the centers and the departments and the individuals who are working in this. I'd be curious to hear from your perspective, but from my perspective, working in this space, even though there are groups who acknowledge the importance of the organizational aspect of health literacy, there's still a long way to go in terms of building those capacities and those competencies across institutions and really making the case for why organizational health literacy needs to be a priority.
Yeah, and I think there's also some like disagreement or conflict about how things have to be done and how things could maybe be changed to be better. And change is hard for anybody, and it's especially hard when maybe you don't understand or appreciate why it's so important. And I think there's just probably regulatory type things, not that I could speak to any of that, that could be barriers in people creating that kind of change. And like you mentioned too, of just the knowledge and capacity that people have to make those changes.
Yeah, you raise a great point about regulatory guardrails because I'm not sure how much this comes up for you in an academic setting, but when I think about health literacy support in let's say, the biopharmaceutical industry, there's often this tension between what is required from a legal and a compliance perspective versus what is ideal for the patient or the end user, the person who needs to be able to interpret this information. And it's this constant need to balance, but sometimes there isn't that balance. The legal and compliance side sort of overpowers that decision to the detriment of patient understanding. But again, I think it's something, just another challenge that we have to continue to work through, and why it's so important to have people like you who are in places of leadership who can help us move toward that. So, with that being said, can you give us a snapshot of what types of partnerships or support or collaborations you all focus on at UAMS? Are they all internal, some external? Like, how does your work on a, let's say, month to month basis look? And what types of support are you able to provide?
It is different on a month to month basis. Basically, any kind of health related or health adjacent project organization you can think of, we've worked on it. I kind of like this because it keeps things fresh and new, and I'm always learning something new about health, whether it's more clinical and hospital related or more public health or something, like I said, health adjacent. Internally, we work with departments across UAMS on things like patient education materials and research communications. And externally, we've partnered with all kinds of different organizations, not for profit and community organizations, even other universities across the United States. We have some international clients, government agencies, public health departments, and then even other like hospitals and health systems. We've worked on a wide variety of projects, so material development, editing materials to make sure that they're easy for patients and the public to read and understand and use, training health professionals on communication and health literacy best practices, and then consulting and research collaboration. So it's pretty broad.
Yeah, that's amazing. And now remind me how many people are a part of your team, a part of the Center for Health Literacy?
Well, you said that we were small but mighty, and we're very small. We are a team of three, but the work that the team can do is pretty incredible.
Absolutely. I mean, the expansiveness that you just laid out and juxtaposed against a team of three, it must mean that you all are doing some pretty amazing work. That's awesome that your institution has your center as a resource to be able to tap into. How much of your engagement with, let's say, internal partners is proactive versus reactive? Meaning, are the departments and divisions like, oh, we've got to get the Center for Health Literacy on this, raising their hand constantly to get your support? Is it more proactive outreach on you all's behalf to say, hey, just as a reminder, we're here and we can help with these things and these aspects? How does that kind of work for you all internally?
I think it's 50-50. The team is probably, we probably collectively spend half of our time or more on grants from our internal research faculty
Hmm.
on various projects. So one of the projects that we all three contribute to is the UAMS College of Public Health has a prevention research center from the Centers for Disease Control and Prevention, and our center is focused on women's health issues, and our current research project is around remote blood pressure monitoring for pregnant women. And so our team contributes to a lot of different aspects of the center. We provide communication support, our typical plain language writing and editing, promotional flyers, and then we've contributed to some of the trainings that the center we either provide internally or externally.
Yeah. Are there any types of trainings, programs, support that you find yourself providing more often than others? Or maybe specific internal partners or external partners, even who are more tapped into the center and who are utilizing your services? I'm always interested to see what the patterns are and how people are leveraging or implementing health literacy services.
For a long time, our most popular service was the editing and material development
Mhm.
work. That's still very popular, but organizations have also, and internally and externally, have we've done a lot more training, I feel like, in the last 5 years, and our popular training offerings are a plain language training, and we've offered it various ways, but the popular way to do that is this workshop. It's 2 parts, and it's designed for the participants to get some real skills out of it. You're not going to be a proficient plain language writer after it, but you're going to have some good awareness and then some solid skills to to help improve materials in your organization, because it's not practical for organizations to submit everything that they write to one of our writers to help them fix it. That can get expensive and cost a lot of time too.
Right. What are some projects that you've been able to work on that you've been most proud of or excited about? And I know you've been with the center for 10 years, so it can be something recent or something that you worked on a while back. But we'd love to hear some of the things that keep you motivated and energized about the health literacy work you're able to do.
Most of them have to do with kind of the plain language writing and material development. So I can give you a early, a middle, and a current. When I came on board at the center, Dr. Haddon had worked with a team at the University of Arkansas Extension Service on this How to Talk to Your Doctor handbook. And I didn't work on that particularly, but the subsequent products that came out of that, after that, we developed a How to Talk to Your Child's Doctor, the CHL team did, and we developed that in English and Spanish. And so we developed a couple in that series, a How to Find Out About Your Health handbook. So I call them the How to Handbook series. Then in the middle of that experience, we really started working on patient education, custom patient education materials at UAMS. Put a lot of work into that and made some great progress in making those materials better for our patients. And then more recently, we received funding from our regional office of the network of the National Libraries of Medicine, NLM, to create this health insurance module for young adults to help them. And that kind of comes from that experience that I
Yeah,
talked
full
about.
circle. I love that.
Of people don't understand insurance, and it's hard to navigate, and spend a lot of time trying to figure out the best way to explain some of these complex issues. And that one is out there on our website, and anybody can access that.
Oh, great. We'll put a link to that in the show notes for this video and the podcast version. Would love to see that. And the custom patient education content sounds like it was maybe a sizable project, but a worthwhile one. Was that for the clinic side of UAMS?
Yeah, that was for UAMS Health side. So that had been transferred to us, and we spent a lot of time working with our clinical partners, making sure that the materials got reviewed and then received a plain language edit. And then we have bilingual staff person who's trained in plain language and knowledgeable about health literacy, and she worked with her team of contractors to get all those materials translated. It's a library of, I think, over 800 materials in English and Spanish combined.
Wow, quite a feat. And I'm glad that you mentioned your translation approach or transcreation approach, because I remembered that you shared that with me. That's a really important element, to not just have translation services available or someone on staff who can support with translation, but to still do so with a health literate eye is particularly important.
Yeah. Oftentimes we find that obviously we want to make materials accessible to any person in any language that we might serve. And so that's the first level of importance. But even when we take our plain language English material, if they're not translated by somebody who has training in some of those plain language nuances, then we end up with materials that are harder for people to understand.
Yeah, completely. Thank you for sharing those specific projects with us. I know that UAMS is pretty unique in its status of having a Center for Health Literacy. A lot of institutions don't necessarily have one, or as you shared with me previously, maybe have a center that's more so focused on theory and research in comparison to practical application. So, if there are other institutions out there listening and they are hoping to elevate health literacy as a priority, or there are individuals who work at those institutions who want to better make the case for incorporating more organizational health literacy approaches into their institution, what advice do you have from your decade of experience doing this work for UAMS?
I think that health literacy really improves when it becomes a part of how the organization operates and not just a little side project.
Mhm.
Although side projects are important too, and
Oh, right?
they're a good place to start. But I think you really need leadership understanding of the importance of the problem and how it can be addressed and a commitment to addressing it. And institutions really have to invest in that expertise either through dedicated staff or strong partnerships with people who have experience and training in health literacy. And it really, like I said before, it has to be built into the processes and the workflows, which includes plain language standards for communicating information with the people that they serve, training for staff on health literacy and health literacy best practices and how to communicate with patients and the public. So it's big, I think. So that could seem really daunting. So that little side project is probably important and maybe could be grown into something that's more organizational.
Yeah. I know the center was already in existence when you came on, but there might have been times over the years where you've had to advocate for additional resources or make the case for why your work is important. Can you think of any effective tactics or best practices that someone can use to demonstrate the impact of health literacy work? If you had to give one or two examples just to make it a little more concrete for people?
I think health literacy can be connected to anything, whatever the buzzword is of the time. So you have to have a good idea of what like the health landscape is and what are the hot topics now, and then a really solid understanding of what health literacy is and how it connects to those issues.
Mhm. I would have considered an example of that, not right now, but maybe a year and a half ago to be health equity. You could
Mm-hmm.
always make the case for health literacy because health equity was such a priority. Now, I might need to find another buzzword to connect it to, but is that kind of what you mean by
Mm-hmm.
finding a connection point? Okay.
Yeah, and in Arkansas right now, I think and maybe even the United States too, rural health and maternal and infant health are the hot topics. So how does health literacy connect to those? That's a pretty easy answer.
That's a good example. Thinking from your role as the director of the Center for Health Literacy, but also your roles in the broader health literacy ecosystem, the US Health Literacy Association. Did I get that right?
Mm-hmm.
What are your hopes and dreams for the health literacy ecosystem over the next 2 to 3 years? Where do you think we can go? What do you think we need to do in order to move the field forward and ultimately help patients in a more effective and cohesive way?
One of my biggest hopes and dreams is to continue and expand training for future health professionals in clear communication and health literacy best practice. There are simply just, I don't think, as many people with deep understanding and training in this area. For example, so many times we hear people say things like health literacy is equivalent to a health education campaign, or they think it's focused on like readability of materials, but we both know that there's so much more to health literacy than that. And if we want clear communication to become the norm, we have to build those skills into education and professional training. And I don't think that starts just at the the health profession program. I think that is before the program and it has to continue after graduation. We saw during COVID what happens when health communication breaks down. The consequences are real and long lasting. And my hope is that we really can learn from that and prioritize clear communication moving forward.
Yeah, I share that vision, and I'm glad that's something that is on your mind and on your radar as well. I do think that from an institutional and an academic level, it's more effective than a one-on-one level. But I have seen some success with being able to do those trainings on a more individual basis for fellow pharmacists and nurses who are particularly interested. Oftentimes, they come in thinking, "Oh, I'm just going to learn how to write an explanation of a disease state for a patient. I can do that. I do that every day." And then they start the training and they're like, oh, I didn't think about the audience and I didn't think about barriers, and they start to realize all the things that are a part of health literacy that they never thought about. And I think it makes it clear. We've come a long way, but we have a ways to go, I think is how we could summarize.
For sure.
Well, thank you so much, Katie, for joining us for this conversation and shedding light on what it looks like to incorporate health literacy at that organizational and institutional level. We wish you the best in the continued success of UAMS's Center for Health Literacy.
Thank you so much, and thanks for having me. It was fun.